Hi, my name is Angela. Would you subscribe to my channel to support me? Mental health has many illusions that it is why it is often difficult to sort through the rumble. In mental health, we have to deal with bipolar on many levels, panic disorders, depression, trauma, and other more difficult diagnoses and symptoms. It is often difficult since when we look at the various mental illnesses we also have to look closer at the underlying elements of the diagnosis. Underlying elements such as childhood trauma plays a large role in many diagnoses today. We also have to consider the many elements that are linked to mental health, including influences of the past and influences in the current times, including history, law, religion, and so on. All diagnoses regardless of the similarities are treated differently, since we are all different. Delusional disorders, for example, require careful attention since the symptoms include separate elements and since it has a couple of different levels of complexity. For example, the persecutory types endure suspicious behaviors, which include believing that someone is out to get them, feeling of cheated in life, feel they are mistreated, and will often include the law and justice system in their delusional behaviors. Delusional disorders are difficult simply because the patient is often schizophrenic, acting yet distinct of the characteristics and symptoms that schizophrenias illustrate. Some patients with delusional disorders have a grandiose personality, believing they are better than anyone else is in the world. The patient may attempt to convince another individual that he or she was cheated, mistreated, robbed, and may believe he or she has power that no one else has. Since minimal research results have been provided on this diagnosis, it is even more difficult to understand. Most delusional disorders are categorized by schizophrenia, however, it is rarely diagnosed as schizophrenia. We could also conduct an overview of cognitive disorders and see that although they appear simple in form, they are complicated. Delirium, for example, has symptoms including lack of awareness, short attention spans, wandering communication, rambled speech, and so forth. The patient often skips in and out of reality. To determine if the diagnosis is delirium, a counselor must rule out other possibilities including psychotic, dementia, schizophrenia, and other related diagnoses. Other diagnoses such as histrionic personality disorders are even more difficult to deal with. Although the person rarely suffers hallucination, they are often illusion in their way of thinking. The person often believes illustrates superficial characteristics in emotions, and will become aggressive, even violent, if they are not the center of focus. In other words, if you are not paying thorough attention to a histrionic, you had better watch your back. Often histrionic types play a role acting out a personality that does not exist, and will shift moods often. If you see a person laughing and carrying on 1 minute, and then turns violent, you might be dealing with a histrionic personality type. Histrionic types are never the culprit, they are often the victim according to their state of mind. As you can see, you are dealing with a very twisted mind here, and to take the person lightly is asking for nothing but trouble. Histrionic personality types play many games, but when you are the game player, there are potential dangers involved. Histrionic types will go at great lengths to prove everyone wrong. Often these types of individuals lack the ability to show emotions at a normal state. We can also peek at the narcissistic personality disorders. These people are similar in contrast to the histrionic in the sense they too are grandiose. They illustrate behaviors that include self-promoting, and often lack the ability to regard others. Often this type is demanding, and often has difficulty in relationships, since everyone is the bad guy. Looking at both histrionic and narcissistic personalities, we can see the similarities, which make it difficult for anyone that is evaluating the patient. The professional evaluating the patient must also rule out other diagnoses including borderline personality disorder (BPD), histrionic personality disorder, as well as other underlying disorders. The many mental illnesses that we face every day are often difficult, and when new studies find more information on the illnesses, it becomes even more difficult to understand.